In this video, we'll be going over the exam for the glossopharyngeal nerve, as well as the vagus nerve and the hypoglossal nerve. The glossopharyngeal nerve, cranial nerve 9, sends sensory to the posterior one-third of the tongue, as well as the pharynx and middle ear, motor to the stylopharyngeus, and autonomic to the parotid salivary gland. The vagus nerve, cranial nerve 10, sends sensory to the tympanic membrane, external auditory canal, and the external ear, as well as motor to the muscles of the palate, pharynx, and larynx, and autonomic afferents from the carotid baroreceptors, parasympathetic supply to and from the thorax and abdomen. The hypoglossal nerve, cranial nerve 12, sends motor to the intrinsic muscles of the tongue. Given the overlap of the regions impacted by cranial nerves 9, 10, and 12, we will evaluate them collectively by region. To evaluate the mouth and tongue, ask your patient to open their mouth looking at their gums and tongue, noting the size of the tongue and any movements in the tongue, the color as well as the texture. Ask your patient to stick out their tongue and notice, does it move straight out or deviate to one side? For the pharynx, look at the position of the uvula. Is it central? You may need to use a tongue depressor, and you can ask your patient to say, ah. When looking at the larynx, ask your patient to cough and listen to the onset, noting if it's explosive or gradual.